All right, so today I'm going to discuss the Prader Willi Syndrome Medical Alerts Handbook. We have these books in all of our vans and at our homes where we support people with Prader Willi Syndrome. They're very important to have because a lot of times medical professionals and other people don't have experience working with people with Prader Willi Syndrome, so you have to be the person that helps to educate them. We'll just touch on some important points. There's a lot of important considerations for emergency treatment of people with Prader-Willi syndrome. Um, the first, obesity and its related complications are the major cause of mortality in PWS. So we really work on maintaining a healthy weight, which minimizes a lot of those complications. Doesn't completely nullify them, but it minimizes them. There are unique medical and behavioral problems linked to Prader-Willi syndrome, regardless of the person's weight status. Somebody can be at their ideal weight and still have a number of medical issues, which we'll discuss as we go. People with PWS often have early onset osteoporosis, and so falls and fractures can be a major issue. They have a very high pain tolerance and not a lot of complaints of pain. So a lot of simple falls can cause significant fractures that require x-rays. If there is pain, swelling, or decreased movement, we want you to go and get an x-ray. We've worked with a few people who have had some pretty serious injuries in their life and not shown any signs of pain. For example, we work with a young lady who previously to moving in with us had fallen and fractured her knee. Nobody noticed it till probably 2 days later that she was limping. And when they took her to get an x-ray, she needed a knee replacement. So she was in quite a bit of pain. Well, should have been in quite a bit of pain, but wasn't expressing that at all. So the pain tolerance is very high. That's just one example. Hyperphagia is excessive appetite, which is probably the hallmark syndrome of Prader-Willi, the hallmark symptom of Prader-Willi syndrome. People are always searching for food. They don't feel full. They never have that feeling of being satiated. Normal weight is achieved through strict external control of food intake. So we lock our kitchens. It's one of our restrictive procedures at Mainstay. And this helps to cut the anxiety that goes along with that. And then people with PWS really need to be monitored both in their home and when they're in a hospital setting. A lot of times when they're there, they'll have access to food that they wouldn't normally have. And there's a risk of choking from trying to ingest that food too fast or getting too much food. Medications can have an adverse reaction. A lot of times medications, they'll have unusual reactions, people with Prader-Willi syndrome, especially medications that are used for sedation. And because of their metabolism, a lot of these drugs may be impaired. Their effects are impaired by their slowed metabolism. So what would normally work for a person without PWS isn't the typical dose that you would use. So you need to address that with any clinicians or doctors that you're working with. People also have pain and sensitivity. We talked about that just a few slides ago about the high pain tolerance that many people experience. They won't tell you that things hurt. So a lot of times emergency departments just release people to leave because when they say, does anything hurt? They say no. But then as a residential provider or a staff person, you're seeing people fall or noticing a lot of odd behaviors that don't typically occur. So you need to make sure that you're advocating for the person you support. They may not complain until an infection is really severe. You may not even know that somebody has an infection until you get to the hospital and it's so severe the doctor's wondering why you didn't bring the person in prior to that. And then any complaint of pain whatsoever from any person that you work with should really be taken seriously, because if they are complaining of pain, there probably is something going on because of the high tolerance they have. Skin lesions and bruises, as you get to know any person with Prader-Willi syndrome, skin picking is pretty common with a lot of the people we support. There's a lot of different things that you can do to help to decrease that behavior in a person and to help them to kind of focus on other things for their anxiety. But that skin picking can lead to infection. So we really want to monitor that, talk with them about that, make sure that any hospitals or medical personnel know. People also have a tendency to bruise easily. And the appearance of those picks and those bruises a lot of times can lead to suspicion of physical abuse that isn't occurring. But if people aren't aware of the syndrome and those behavioral issues that go along with it, they oftentimes will think that people are being physically abused. So you need to make sure people are aware and that you have a good relationship with your PCPs and your other doctors. Swallowing and choking is always an issue that you need to make sure that you're considering how people's food needs to be cut up, what it should look like, what their diet should be. Most people with Prader Willi syndrome may have some sort of swallowing problem, and it can place them at a risk for choking. It doesn't mean that everybody's food needs to be cut up, but you need to evaluate that. And typical swallow studies aren't recommended because a lot of times people can't tell you if they cleared their airway. So in a normal swallow study, they would ask, and people with Prader Willi syndrome don't always know if it's cleared. Choking also can occur with rapid ingestion of unguarded food and has led to many deaths in the population of people with PWS. So people will eat quickly, especially if it's food that isn't on their diet and that they found and that they're trying to get before somebody notices. Temperature abnormalities, we talk about this a lot in our residential homes because a lot of times we talk about the right to risk and people's rights as an individual. And a lot of the women we work with will want to wear skirts with no sock, with nothing underneath when it's 2 degrees outside in Pittsburgh. So we really have to talk to them about hypothermia, how those things might happen when it's extremely cold, and the fact that they don't regulate their body temperature because they have a flaw in their hypothalamus. So their average temperature is often off, either a little bit higher or a little bit lower than a standard temperature. And you really need to address that with the people you support. There also might not be a fever, even if there's a serious infection. So that's something you need to think about. And hypothermia can occur quickly during any minor illness or procedures that require anesthesia. So you really have to make an anesthesiologist aware of the person's Prader Willi syndrome. Vomiting or the lack of ability to vomit. So almost never does a person with Prader Willi syndrome vomit. It's very rare. And that lack of ability to vomit is really concerning because a lot of times people will ingest food that was uncooked or spoiled or otherwise unhealthy because they have that drive to eat, the hyperphagia that goes along with Prader Willi syndrome. So the presence of vomiting may signal a life-threatening illness, and you really need to get the person to an emergency room and explain to the emergency room personnel why you're there and the fact that people with Prader Willi syndrome don't vomit. And every time we've seen that happen, it's usually been a problem. There was a time we took a young man to the hospital because he vomited, and they weren't going to evaluate him, but then they did, and he had an incarcerated hernia, which actually had led him to vomit, and it could have been life-threatening. So it was good that the staff acted on that and knew that that was a serious health issue. Water intoxication. So this can occur because of certain medications with antidiuretic effects. You don't always want people to have those. You want to make sure you talk to the doctor and make sure they're aware of the Prader Willi syndrome. And then you also want to talk to them about fluid intake. And what that should look like. A lot of times people with PWS don't drink a lot of water, but sometimes they will binge on fluid. So you do have to monitor that as well, because that can lead to serious medical issues. And there is some colonic distension, necrosis, or rupture. I should say may cause severe distension, not MAT, but respiratory concerns. People with Prader Willi syndrome are at an increased risk for respiratory issues. They have hypotonia, weak chest muscles, the swallowing abnormalities, and sleep apnea are common. So hypotonia is low muscle tone. Anyone, regardless of age, with significant snoring should have a medical evaluation to look for obstructive sleep apnea. So some people will be diagnosed with sleep apnea as an adult. If somebody is snoring really loudly, you should get them evaluated. And then children with Prader Willi syndrome often have issues with stomach reflex aspiration. And then next, we're going to just talk a little bit about some inpatient considerations. And these are concerns that you should address with the medical team if a person with Prader-Willi syndrome is hospitalized. So remember, you're their advocate. You should be in there talking to the medical team, talking with the family, and making sure that everybody's on the same page and is really aware of the issues that surround Prader-Willi syndrome. So anesthesia is a big concern. Again, you want to make sure the anesthesiologist is really aware of the complications that occur with people with PWS, because a lot of times the standard dosages of the anesthetic agents don't work for people with Prader-Willi syndrome. It's too much, like they need a really little bit for their weight. Serious problems can occur during conscious sedation if it's not really well monitored. And the PWSA website has a number of articles to share with doctors prior to anesthesia. So they have a plethora of information on their website that we will take with us to appointments to make sure that we are sharing with them so they are very aware, because we don't want any issues to come up. Behavior problems. So many behavioral issues are directly related to the anxiety people feel around their hyperphagia or need to and drive for food. When there's a serious infection or illness or such a big change in routine, like going to the hospital, there can be more of this. There's more emotional outbursts. Some of the obsessive compulsive behaviors will come out. There's a likelihood of psychosis because of that drastic change in routine. And psychotropic medications may affect metabolism and anesthesia. So there could be a shorter or longer duration of the actions around the psychotropic medications. There can also be some cardiac problems related to staying in the hospital. They are due to hyperventilation or right heart failure. Edema can be seen in an obese individual, even if there's an absence of heart failure. And how they treat that is just weight loss and ambulation. You want to make sure that people are moving. It's not recommended that people with Prader-Willi syndrome stay on bed rest for any length of time. And diuretics that are beneficial to most people who have edema are not beneficial to people with Prader-Willi syndrome generally. Of course, that's evaluated on a case-by-case basis, and a medical professional will make that decision, but it's something to make people aware of. So the food-seeking behaviors or relentless hunger really can be an issue, as you can imagine, while somebody is inpatient. There really should be complete safety from access to food. So their diet should be monitored there. You should assume the individual has eaten unless verified by the caregiver, because a person with Prader-Willi syndrome will tell you every time that they have not eaten yet. And any complaints of hunger should not result in access to food. They shouldn't be given more food or food outside of their regular diet. And then patients that are in the hospital should have someone with them at all times. We have worked with different hospitals, and we've had sitters in place that are just there as someone to be with the person. We've provided staff for people that really need that, or we work with families to see if they can be there so that their loved one isn't having extra access to food, because every individual that we support at Mainstay is on a restricted calorie diet, and that really needs to be conveyed to the nutritionist. It isn't always followed, but that's why we really try to avoid hospitalizations such as 302s or elective surgeries. When people are hospitalized through Mainstay, the people that we support here, it's because it's a serious medical concern and it needs addressed. So hypothalamic dysfunction is the major issue with Prader-Willi syndrome. There's a flaw in the hypothalamus. Hypothyroidism may not be diagnosed prior to a surgery. Oftentimes people have worked with an endo doctor though, so they've worked with their endocrinologist, so it will be. The hypothalamus also affects temperature regulation, and as we talked about before, people don't always regulate their body temperature with Prader-Willi syndrome. They actually don't do that. Hunger is affected by their hypothalamic dysfunction, as well as respiratory issues and some of their behavioral patterns. So some other considerations when you're inpatient, hypotonia, that's the muscle weakness, and that can complicate the ability to cough effectively and clear their airways. You want to make sure that people are aware of that and that they're monitoring, that they are able to cough and they're able to use their breathing things if they're having a surgery. Narcotics may have an exaggerated response, and delayed gastric emptying can compound that. So there may be issues with narcotics. Obesity, considerations for obstructive apnea, pulmonary hypertension, diabetes, and right heart failure should be addressed if the person you support is obese that has Prader-Willi syndrome. Again, the pain and sensitivity that we've talked about a lot. A lot of times people won't tell you they're in pain, and the only time you know is if they have the shallow, rapid breathing or their heart rate is really rapid. So that might be your only indication that they are in pain, or if they're having a behavioral issue that is not typical of that person. So pulmonary embolism also occurs frequently in people with Prader-Willi syndrome that are impatient, and they do not recommend prolonged bed rest. So you should avoid that and move around and make sure people are maintaining a healthy weight. We talked about psychosis already. It can be triggered by serious illness or major changes in routine. And then saliva abnormalities. You'll notice that most of the people we support with Prader-Willi syndrome have thick saliva in the corners of their mouth a lot of the time. So that thick, sticky saliva complicates airway management. So it's also another consideration for medical professionals. And then skin picking, that occurs in most people at some point with PWS. Not every single person, but it's very typical. So this may complicate the healing of the IV site. And then the temperature instability. A low temperature is typical, a low normal temperature. So they're normally at a 94. You want to make sure the doctors are aware of what their base temperature is, and they also have some poor control during fevers. You don't always know that it is a fever because their base temperature is low. So they might have a fever at a regular temperature. Severe gastric illness is it happens with a lot of people with Prader-Willi syndrome. So the presence of vomiting is always a concern, and gastric problems are very common. Abdominal distension or bloating or any pain or vomiting might be a sign of life-threatening gastric dilation. So if you notice that in a person that you're supporting, you need to make sure that you're contacting somebody immediately and making them aware. If you work with somebody who has a bloated belly, which we have a few people we support that do, we work with their PCP regularly to make sure they're on a bowel regimen so that they aren't getting impacted, because colonic impaction is also a really major concern. So we want to make sure if you're noticing hardening of their belly, or if the belly looks more distended than usual, we want to make sure we get them to the emergency room or to their PCP as quickly as possible. All right, and then this is just some resources. The PWSA website has all of that information from this medical alert book right on their website. And we have IPSO, which is the International Prader-Willi Syndrome Organization. They have some great resources on their website as well. And the PWSA app has all of the information from this medical alert book right on the app. So it's great to have that and be able to just pull it up when you go to the emergency room. So if you have any questions regarding any of this, please ask us, and I will talk to you soon. Thanks. Bye.